So today let's talk about risk versus benefits of medications. Now, oftentimes the physician will inform you about the potential risk factors and side effects or complications of a medication. As a patient, how do you think about this? How should you approach this? How should you identify it? Well, ultimately it comes down to you and your risk parameters. And we could really go into the statistics of the Gaussian curve and look at the fat tails and thin tails of risk profile, etc. But I'd like to really sort of make it very simple for you guys and explain to you how I normally consult with my patients and how I ask them to think about risk versus benefits of procedures and medications. Once you've identified the advantage of partaking in a behavior or a medication, we then need to think about what are the potential side effects or risks or complications. Well, if we take the analogy of driving a car, what is the potential of having an accident? Well, usually if you are driving safely, not under the influence of any drugs or alcohol, you're not texting whilst you're driving, the probability is very high that you're going to arrive at your destination very safely. Now, of course, there are extraneous factors that we can't take into consideration. So these are all factors that you can minimize in reducing the risk even further, but they are tangible risks that you have to take into consideration when driving a car. So if I was to be thinking about this treatment or modality, I'd think about what are the benefits and how important are these benefits to me, and it differs from person to person, and what is my risk profile. When you're going to take a medication, there will always be potential risks and side effects. And of course, we will give you a consent form with the largest studies that we know of to hand with a statistical risk. And that's all we can really do as physicians and specialists, to give you this data so you can make up your own decision around your particular risk profile. But then not taking the medication and not partaking in a particular behavior, if you've come to see somebody about losing your hair or treating blood pressure, etc., that also carries ramifications which you need to accept, such as if you're not protecting your native grafts after a hair transplant, the consequence is you will continue thinning. Your hair loss will be more unpredictable than normal. So let's talk about hair loss medications such as Finasteride, and that's the big elephant in the room when we often talk about hair loss or hair transplants. Well, the benefits are approximately we're going to have a 50 to 60% stabilization of your native grafts, which is very good. And 33% of men may even experience thicker hair after taking it over a year. And of course, the risks of the medication, the main one that people talk about is sexual dysfunction. And the statistical risk that has been documented in the largest study is around 1.8 to call it 2%. Now, this may be unacceptable for some patients, and if that's the case, then this medication is not for you. And you should think about the consequences of not taking the medication, which is Mother Nature will continue doing what she's doing. This is not a disease, it's not an illness, it's genetics, like having blue or green eyes. So then we accept that this hair loss is going to continue, and we accept the fact that Mother Nature is going to carry us along her evolutionary trajectory. If we choose to take the medication, of course, we are accepting the benefits of stabilizing our hair loss. This is important to the way we feel about ourselves, the way we carry ourselves, our confidence. These are the benefits. However, there's no free lunch. And if you're prepared to accept the risk, then we take the medication. So in life, always be responsible for your own decisions. Always understand the risks. Ask your physicians about the risks, the statistical risks. Some of the treatments out there that are being sort of touted as golden bullets, such as, new creams, lotions, and potions, there may be studies to support their use, but always ask what was the sample size of the population it was performed on? Was it a double-blind study? Were there any extrinsic factors which could have confounded the results? And these are very important to consider when you're thinking about jumping into a treatment. Some treatments in my practice I found to be very, very helpful, but these are very personalized findings that I found during my practice. I can't generalize these to the wider population because the sample size is quite low. And what you'll often find is that because of a lack of funding by pharmaceutical companies, a lot of the off-label treatments, such as mesotherapy, PRP, we don't have enough data on it. We may have very robust data on smaller sample sizes, but until we have larger cohorts of studies, we're going to be a little bit limited. So having said that, to group this all together, always understand the risk profile, always understand the benefits, always understand the probability of risks versus benefits in terms of numbers, if they are available, and don't be afraid to ask more questions. Finally, once you make a decision, accept that with responsibility, because as patients, as clients, as individuals in life, one thing we really need to get away from in society is not being responsible for our own decisions. So whether you decide to take something or decide not to take something, whether you decide to drive a car or not drive a car, understand the risks and benefits and accept it, and then we move on. I do hope this helps in terms of thinking about medications, how to turn it into an everyday analogy. And if you would like further information or any other help, please comment below. Very, very happy to elaborate further for you. Thanks very much.